Greetings to Sir and all my fellow classmates. For this project, before that, let me introduce myself. My name is Muhammad Zulsham Ashrafi Ibrahim, and for this project, my partner will be Muhammad Firdaus Lee. For LCC 402 English for oral reporting, the topic that we chose is exploring the leading causes of death in Malaysia, focus on heart disease and its risk factors. In 2019, the total number of deaths in Malaysia was 173,746 people per year. And for sure, one of a graph will show the top causes of death in 2019. The topic that we choose, ischemic heart disease, is very common among Malaysians nowadays. For the credibility, ischemic heart disease is the top causes of death among Malaysians in 2019. My partner will explain more about why it became the top causes of death in Malaysia in 2019. So for the central idea, ischemic heart disease or IHD has become the significant global health issue, meaning that it's not only happened in Malaysia or other neighbor country, but it's happened in worldwide, or we can see it's globally happened. So most of the cause of death in Malaysia happen because of unhealthy lifestyle. I don't want to explain more about the unhealthy lifestyle because that will be explained by my partner after this. So for the chart number one, the type of chart that we use for this is bar chart, which is, we can see the title here is top causes of death per 100,000 population in Malaysia 2019. Before that, we gained this chart from WHO website itself. For those who don't know, WHO is a World Health Organization that become the global operation for the health team. So let's we go through the bar chart. As you can see here, the IHD or ischemic heart disease stated in ranking number 1 with 112.3, followed by stroke 69.5, lower respiratory infections 60.8, kidney diseases 22.8, road injury 19.1, chronic obstructive pulmonary disease 18.9, diabetes mellitus 15.5, cirrhosis of the liver 15, Alzheimer diseases and other dementias 13.6, and lastly is trachea, bronchus, lung, and cancers 12.7. Let me explain a little bit about this graph. For me, it's quite shocked me regarding the road injury and the trachea, bronchus, lung cancers, not in the top 3 of the ranking, because for the road injury, we all know how Malaysians drive nowadays. It's very, very dangerous. And the lastly is for the trachea, bronchus, and lung cancers. We are all well known that in this era, in this specific year, they are very difficult to find someone who don't smoke. So it's quite shocking me, or it's quite shocking me actually. But let's ignore it first, since the topic for this presentation is ischemic heart disease. So let's move to what is ischemic heart disease. Ischemic heart disease is a disease that suffered by a person who did not take a good care of his health. So what are the average age usually involved in IHD or ischemic heart disease? For me, in my opinion or in my experience, there are no specific age that involved in IHD, because as so far as I know, I have a friend who suffered from IHD at the age of 20 to 21 years old, which is quite young age. So the oldest patients that suffered from IHD is around 80 to 81 years old. So we can conclude here that the IHD doesn't look at your age, but if you do not take a good care of your health, you might get a IHD or ischemic heart disease. I need to mention that IHD is very, very dangerous for our health, because IHD can lead to death. So the next one is, what are the symptoms of ischemic heart disease? There are few symptoms that IHD patients usually suffer, but let me short it to 3 major symptoms. Number 1 is easily get tired when doing some or small activities. Number 2 is hard to breathe, and number 3 is feeling pain around the chest area, where is the heart located. We can see here that when we feel hurt or pain at the chest area, meaning that we might want to see a doctor, because it's one of the famous or major symptoms regarding about IHD. So for the next chart, number 2 is, my partner will explain about it in the next slide. So I will invite Muhammad Firdaus to explain on his part.
Thank you for Muhammad Zalisam. Now is chart 2. On my first point, what is the top main cause of ischemic heart disease? Uh, as I know, the main cause of ischemic heart disease is dietary risk. Unhealthy diet life could lead to plaque buildup in the heart arteries, and the plaque As you know, as my knowledge, the plaque is made up of fat, cholesterol, and other substance that stick to the artery walls, which would make the artery walls narrow. And this will limit the blood flow to the heart, so it doesn't get enough oxygen, especially during we are doing activities or in stressing situation. And when the blood flow is too low, it can cause a heart attack if a plaque breaks open and blocks the artery. High cholesterol, smoking, and lacks of exercise are all factors that can lead to this uh, buildup of this plaque. Second point, how could an external cause can contribute to ischemic heart disease, such as air pollution? Air pollution contributes to ischemic heart disease because harmful particles in the air can damage blood vessels, such as carbon monoxide. When polluted air is inhaled, it causes inflammation and stress on the heart and blood vessels, leading to higher blood pressure and greater risk of plaque buildup in the arteries. Because there is a lot of substance inside our arteries when we are breathing. Over time, this increases the risk of heart disease by restricting blood flow to the heart. For my third point, do the difference of gender affect the risk of a certain gender? Uh, in my research, yes, it will affect. Gender differences can affect the risk of ischemic heart disease. Especially men generally have a higher risk at a younger age, while women risk increase significantly after menopause due to hormonal changes. Women may also experience different symptoms like nausea or fatigue instead of chest pain, which can lead to delay diagnosis additionally. Additionally, lifestyle factors and health conditions like diabetes often impact women heart health more severely than men's. Okay, for our conclusion, after presenting this, we could conclude that to live a healthy life, we need to take a good care of our health so that we do not contribute to the increasing percentage for ischemic heart disease in our country. In other words, an apple a day keeps the doctor away. That's all from us. Thank you.